Hello, I'm Courtney Powell, and I'm here with my husband, Commander Obie Powell. Obie is a general surgeon in the United States Navy, and he has had the opportunity to deploy to many places. He has been to Afghanistan 3 times. In this interview, he will be discussing his experiences with Afghan healthcare. Hi, Obie. Thanks for joining me today in this interview. When were you deployed to Afghanistan, and for how long did you spend there?
I've been deployed to Afghanistan 3 times. The first time was in 2008, and again in 2010, and finally in 2011. I've spent a total of 18 months there.
And what was your role when you were stationed in Afghanistan?
I was working at forward surgical teams as a trauma surgeon.
Okay, so you were taking care of our American military troops as well as any Afghani patients that needed care?
Yeah, so the first time I went to Afghanistan, early on in the war, we were uh, providing more care towards the Afghanis. I was working with a special forces group, and as their mission had them work closer with the community in support of them, we were able to provide more medical care to the community on my first deployment there. And my subsequent deployments, we weren't able to provide as much general surgical care. We still provided trauma care to the Afghani people that were injured as a consequence of the war that was going on there. My first deployment was 9 months, and I spent a fair amount of that treating Afghani surgically for non-war related issues.
Okay. What types of healthcare are available in Afghanistan? Do they have a wide range of specialists there, or is it limited to more general practitioners?
Well, where I was stationed was usually well outside of the larger cities. My understanding is that they do have more specialists within the cities, but this was more of a rural area, and these were mostly general practitioners. There was a surgeon that would come occasionally that would help, but he wasn't there permanently.
Okay. And what are traditional healthcare practices in Afghanistan? Do they practice a lot of alternative therapies or folk remedies, or do they practice more westernized medicine?
Sure. Well, the Afghanis themselves rely heavily on traditional folk remedies for simple issues. The physicians all uh, lean towards more modern Western care, the best that they can provide it with the limited resources that are available to them.
So you would say the physicians are pretty modern with their practices and their knowledge base, the ones that you've worked with?
Sure, like, I don't believe the ones I worked with closely had any residency training. They mostly got their medical training from Pakistan. Some of the older physicians there did receive some training in the former Soviet Union back in the 80s. Uh, I was able to spend a little bit of time at one of the hospitals in town, and they had for the area a relatively modern operating room with modern equipment, although the surgeon wasn't available at the time.
What are some common healthcare problems among the Afghani people?
Well, interestingly, I ran into, for the male population, quite a few patients that suffer from bladder stones, which is something you almost don't see at all in the United States or Western countries. So I did some research on that and found that it's actually due to their low protein, high carbohydrate diet. So it's an endemic problem. It can be quite a problem. I treated patients from the ages of 3 years old who had a couple bladder stones all the way up to some older gentleman who had an entire bladder full of stones, well over 150 small stones in their bladder that we removed.
Wow, that's amazing. What other challenges do they face regarding healthcare?
Well, simply access to care is not that available for them. There were some of our patients would tell us stories that they traveled for multiple days to get to us to be seen. Also, they would travel to Pakistan if they needed any care more than what could be available in their local small villages or towns. Uh, Also, one of the big problems for us was the idea of ongoing care and follow-up care, which is not really something that they uh, understand in Afghanistan, that some issues could require ongoing care. Uh, Due to the lack of infrastructure and resources and supplies available, I learned very early on after I needed to place a colostomy on a patient that they don't even have simple uh, equipment that they can take care of a colostomy. And it was very difficult for this man to work on a daily basis uh, until we were able to reverse his colostomy. Also, these patients have a lot of issues with intestinal parasites that frequently, on almost every patient that we took care of that had some sort of intestinal injury, we would find uh, these free-floating parasites in their abdomen that had escaped their bowel. So that leads to some issues with malnutrition um, and difficulties maintaining good nutrition.
That's very interesting because in the United States, as you know, so much of our healthcare that we provide depends on continuing and ongoing care and providing the patient with resources after they're discharged. And we think something like a colostomy is such a manageable condition, especially now with advancement of products and you can maintain an active lifestyle. Even in the United States, an amputation is not a big deal. Well, it is, but I'm saying we have the technology, we have the new prosthesis and prosthetic technology available for people. So in Afghanistan, I know they don't have that technology. Is that correct? They don't have like the physical therapy component and all that.
Sure, that's true. We had to early on amputate a young man's leg. He was 8 year old above the knee, and for some ongoing medical issues, we saw him almost the entire 9 months I was there, off and on, and he had crutches, and that was as good as it was going to get for him.
Yeah, that's hard. One last question. Since you were in Afghanistan a few times and it spanned over a couple of years, did you ever notice any changes in care, or was there any technology that you noticed advancing, anything that they were making improvements in?
Uh, so not that I noticed that there were these improvements, but for the last couple times that I went, we were attempting, instead of just taking care of Afghani patients, we were attempting to incorporate their physicians into it to help, not necessarily train them, but have them to be part of the decision-making process and the treatment management. So we would have Afghani physicians who would diagnose their patients with surgical issues, bring their patients to our base, and work alongside us to further diagnose, whether it was with x-rays or labs, physical exam, and if they went on to operation, to actually be part of the operation while we were repairing these issues. that had become a much bigger role as from before. When I was there the first time, the Afghanis were never part of the treatment. We would take referrals from their hospital, but the Afghani physicians would not accompany the patients and participate in their care. So as time has gone by, we've tried to help get their physicians some training, although unofficial training, and to help them take care of their patients.
Yeah, and it's almost like a collaboration. You guys, U.S. surgeons, are working with Afghani physicians and surgeons. So,
Sure.
okay. Well, thank you for joining me, Obie, during this interview regarding healthcare in Afghanistan, and appreciate you talking with me.
My pleasure.
All right. Bye.
Bye.